We usually recommend our patient to eat softer diet for initial 2 to 4 months. Very common question asked by our patient is, what can I eat after receiving full mouth implant fixed teeth treatment? We usually recommend our patient to eat softer diet for initial 2 to 4 months, because during this 2 to 4 months the old bone is getting converted into new bone by the process called remodeling, and during this phase the bone is little weak. So the amount of forces coming on the bone should be minimum, not like very high. So that is the reason we ask our patient to eat soft diet. Also, the patient who have undergone full mouth fixed teeth treatment, they should understand this is a full mouth rehabilitation process. Rehabilitation means we have to get the patients from the most compromised situation to the normal situation. For example, a patient who have got a fracture of his leg cannot just simply run on third day of his treatment. He will gradually and slowly develop his speed, and then he may run after few months. So that is the same way here. Patient will slowly gradually develop the chewing habits from soft diet to the coarse diets. The most important thing is how to eat. Patient have to eat food from both the sides simultaneously, from right and left side at the same time. It should not be, patient should be chewing only on one side. This is absolutely wrong. If you're chewing from only one side, this is going to cause some problem. Secondly, patient should not chew from front teeth. Front teeth should not come in contact regularly. Never. The patient should use his molars and premolars for chewing of both sides. Follow-up forms the most important aspect of the dental implant treatment. During the follow-up visit, the patients are checked for bilateral contacts. That means there should be equal contact on both sides. We ask our patient to give follow-up after 1 week period of time, after 3 weeks period of time, then after 6th month, and then every year once, at least once. Annual checkup is mandatory. Why these follow-ups are very important? If suppose we create a bilateral contact on both the sides on the 3rd week of your follow-up visits, but there is a tendency, because of muscle adaptations, you may develop contacts only on one side after maybe 6 months or 8 months. So during your subsequent follow-up visits, we will check out what kind of contacts has been developed. If the inadequate contacts are there, then this will be adjusted to develop again a bilateral equal contacts, which is very important for the success of any implant treatment. So that is the reason the follow-up is important. Now you must be wondering why the unequal contacts may develop. Because our lower jaw is not fixed to our skull. Our lower jaw is adapted to our skull by means of some joints and by means of some muscles. So if the muscles are relaxing or getting contracted in future, so definitely the jaw can shift its position and they may develop unequal contacts on your right and left side. That is the reason a follow-up is very mandatory and it needs to be assessed regularly. So I would say dental implant treatment is never ending process. Always a follow-up is mandatory and you should give follow-up to your consulting doctors.